Hi there, it's Matthew Sharp here. And if you're over 70, listen closely, because some of the most common eye tests being pushed on seniors might be doing more harm than good. That's right. Today I'm revealing 5 tests that doctors rarely warn you about and how they could actually worsen your vision, not protect it. We're talking unnecessary strain, risky dyes, outdated technology, and in some cases, dangerous false positives that lead to overtreatment. So before you agree to another scan, injection, or high-pressure puff test, stay with me. You need to know what to ask and what to avoid. And don't worry, we're not just fear-mongering here. I'll also give you better, safer alternatives to each test so you know exactly what to request at your next checkup. Let's dive in. All right, first up, the puff test. You know the one. You lean into the machine, stare at a tiny green light, and then, poof, a blast of air right into your eye. That's called non-contact tonometry, and it's used to screen for glaucoma by measuring the pressure inside your eye. But here's what many seniors don't realize. This test is often inaccurate, especially as we age. Studies have shown that puff tests can underestimate or overestimate eye pressure depending on the thickness of your cornea. And as we get older, our corneas naturally thin, which can skew results even more. One study published in the Journal of Glaucoma found that false positives from puff tests were surprisingly common in older adults, leading to unnecessary worry, follow-ups, and even treatment. And worst of all, it doesn't catch all forms of glaucoma. In fact, many people with normal pressure glaucoma, which is more common in seniors, pass the puff test completely while the disease silently progresses. So what should you do instead? Ask your doctor for an applanation tonometry test. It's more accurate and involves gentle contact with the eye after numbing drops. Or even better, optical coherence tomography, OCT, if you're at higher risk. It's like an MRI for your retina and gives far more useful information. Remember, the puff test isn't dangerous, but it can be misleading. And when it comes to your vision, false confidence is risky. Coming up next, we'll look at a test that seems routine, but might expose your brain to more than it can handle, especially after 70. Stay with me. Next up, the one where everything turns blurry for hours after. I'm talking about the dilated fundus exam, when your eye doctor uses drops to widen your pupils so they can examine the back of your eye. Now this test has a time and place. It's one of the best ways to catch issues like macular degeneration or diabetic retinopathy early. But here's the problem. For seniors over 70, especially those not at high risk, this test might be used too often, and that can cause some real issues. Let me explain. When your eyes are dilated, your vision becomes blurry, you're extra sensitive to light, and your depth perception takes a hit. And if you're already dealing with aging vision, balance problems, or slower reaction time, that's a recipe for a fall. In fact, researchers from a study in clinical ophthalmology found that dilated eye exams in seniors significantly increase the risk of post-appointment accidents, especially in people who aren't warned not to drive afterward. Plus, here's something no one tells you. These drops can sometimes cause a sudden spike in eye pressure in sensitive individuals. It's rare, but it's a known risk, especially in older adults. So what's the safer route? If you're not diabetic, don't have AMD, and haven't noticed sudden changes in vision, talk to your doctor about spacing out these tests or using non-dilated retinal imaging instead. It's quick, painless, and many modern machines can get great results without blowing your pupils up like dinner plates. Again, we're not saying never do this test, but blindly saying yes every year, even if you're low risk. That's where problems start. All right, the next test is often done with good intentions, but could send you into a panic over nothing. Let's talk about false alarms, stress, and unnecessary treatments, coming up next. Now this next one might surprise you, because it sounds high-tech and advanced. It's called optical coherence tomography, or OCT for short. This machine scans the layers of your retina and optic nerve using light waves, giving your doctor a detailed, almost MRI-like image of your eyes. And yes, it's incredibly useful when it's needed. But here's where it goes off the rails. Some eye clinics are pushing OCT scans at every visit, even when you're not showing symptoms or changes in your vision. That might sound harmless, but let me paint you a picture. Imagine you're told that your OCT shows a suspicious area, nothing painful, nothing you noticed. But now you're sent to a specialist. You get more scans, more poking, more stress, only to find out it was a normal variation or something that wouldn't have impacted your life at all. That's the danger of over-testing in seniors. As we age, the structure of our eyes changes naturally, and OCT picks up every little wrinkle. Not all of them mean disease, but the machine doesn't know that. And neither do you, which can lead to anxiety, overtreatment, or even unnecessary surgeries. In one study published in Ophthalmology Retina, researchers found that a significant number of referrals based on OCT scans in older patients were clinically unnecessary. In other words, it created more confusion than clarity. So when should you get an OCT? If you're experiencing blurry central vision, sudden distortion, or you're managing a condition like glaucoma or macular degeneration, absolutely. But if your vision has been stable for years and your eye pressure and acuity are normal, you may want to ask, do I really need this scan today? Coming up, let's talk about a test that can trick seniors into thinking their eyesight is fine when it's not. And it could delay the diagnosis of a silent condition that's stealing your vision from the sides. Okay, let's move on to a test that looks innocent, but can be dangerously misleading. It's called a visual field test, where you stare at a dot while tiny lights blink in your peripheral vision and you press a button every time you see one. Now, this is a key test for glaucoma and other neurological issues, no doubt about that. But here's the catch. When used without proper context, especially in seniors, it can give false positives or false negatives. Let me break this down simply. As we age, our reaction time slows, our attention drifts, we blink more, and sometimes we just miss the little lights, not because our vision is bad, but because our brains were too slow to respond that day. And guess what? The machine doesn't care. It flags the result as abnormal. Suddenly, you're being told you may have glaucoma, even though your optic nerve looks healthy and your pressure is normal. This happens more often than you'd think. A study from the British Journal of Ophthalmology found that up to 20% of visual field tests in older adults produced unreliable results, especially in first-time testers. But here's the flip side. Visual field tests can also miss early glaucoma, especially in the early silent stages where only advanced machines or nerve imaging can detect changes. So what's the safer play? If your doctor relies only on this test to diagnose or monitor you, ask for supporting tests like optic nerve imaging, OCT, pressure testing, and a look at your family history. And if your results are a bit off, ask to retake the test on a different day, especially if you were tired, anxious, or distracted. One bad test does not mean your vision is doomed. Coming up next, the final test on our list might seem like just another photo, but it could expose you to something many seniors are more sensitive to than they realize. All right, let's wrap up our list with a test that sounds like science fiction, but is still being used in clinics across the country. It's called fluorescein angiography, a test where a yellow dye is injected into your arm and a special camera tracks how it flows through the blood vessels in your retina. It can reveal blockages, leaks, or abnormal growth, and it's especially useful for conditions like diabetic retinopathy or wet macular degeneration. So what's the issue? It's often overused in seniors without clear symptoms. And here's where that becomes a problem. First, let's talk about the dye itself. While most people tolerate fluorescein just fine, some seniors may experience nausea, allergic reactions, or even vasovagal responses. That's when your body overreacts to the test, causing sudden drops in blood pressure, dizziness, or fainting. Not exactly a fun way to end an eye appointment. And more importantly, if you're not diabetic, haven't had vision changes, and aren't showing signs of retinal swelling or bleeding, you have to ask, why are we injecting dyes into your bloodstream at all? The truth is, modern non-invasive imaging, like OCT and fundus photography, can catch most of the same issues without using dyes, especially for routine checks. That means fewer risks, less discomfort, and no fluorescent pee for the rest of the day. Yes, really, the dye changes your urine color. Another fun fact no one tells you. So if you're ever offered this test and it feels out of the blue, ask your doctor, what symptoms or risks are we looking for here? And is there a safer, simpler way to check it? Now, let's bring it all together with a quick recap, so you walk into your next eye exam empowered, confident, and protected. That's coming up. All right, let's bring it all together, because I know this has been a lot to take in. We've gone through 5 eye tests that aren't necessarily bad, but can become a problem when they're overused, done too often, or not explained properly, especially for those of us over 70. Let's do a quick recap, nice and simple. The PUF test, fast and easy, sure, but it can give false pressure readings in older adults, leading to false alarms or missing real issues. Ask about applanation tonometry instead. Dilated eye exams. These can blur your vision for hours and make driving or walking risky. If you're low risk, talk to your doctor about non-dilated imaging options and whether you need dilation every year. OCT scans, amazing technology, but not always necessary for healthy eyes. Too many OCT scans can lead to anxiety and unnecessary follow-ups. Use it when there's a real need. Visual field tests, great in theory, but reaction time and fatigue can affect results in seniors. Ask for a retest if you're unsure or tired that day, and make sure other tests are backing up any diagnosis. Fluorescent angiography. This dye-based imaging is powerful but invasive. Not something you want unless there's a strong reason for it. If your doctor suggests it, ask about safer alternatives first. Now, I want to make something very clear. We're not here to bash eye doctors. Most of them are doing the best they can to protect your sight. But the truth is, you are your own best advocate, especially as you get older. That means asking the right questions, understanding your options, and not being afraid to say, is there a safer or simpler way? And to make this super easy for you, here's a simple script you can use at your next eye appointment. Seriously, write this down if you'd like. Doctor, I want to protect my eyesight, but I'm over 70 and I've read that some tests aren't always needed as often. Can you walk me through why this particular test is being done, and if there's a lower risk option that would still give good results? See how respectful and open that is? You're not saying no. You're saying, help me understand. And if your eye doctor can't explain it clearly, that's a red flag. You deserve to know what's going into your body, onto your eyes, and into your medical chart. Now let's touch on one more thing, and this part's important. As you get older, your risk for certain eye diseases increases. That's just a fact. Macular degeneration, glaucoma, cataracts, these things become more likely. So it might sound like I'm telling you to do fewer tests, but I'm not. What I'm saying is, do the right tests, for the right reasons, at the right time. When we test too often without cause, we can become overly anxious or even end up treating things that didn't need treatment. When we don't test enough, we risk missing a condition until it's too late. That's why balanced care is the goal. Not aggressive, not passive, just smart. Now let's close with one of the most powerful reminders I can give you. Your eyes are not just organs. They're windows into your independence, your ability to drive, to read a book, to see your grandkids' faces, to enjoy the golden years the way you deserve to. So don't settle for rushed visits and unexplained tests. You've earned the right to ask questions. You've earned the right to understand your care. And you've earned the right to protect your vision wisely. Before I let you go, I've got one final favor to ask. If this video helped you feel more confident about your eye health, even just a little, would you consider subscribing to the channel? We're building a community here of smart, curious seniors who aren't afraid to ask questions and advocate for their health. And I've got more videos coming soon that'll teach you how to keep your eyes strong, your vision clear, and your body sharp, even past 70, 80, or beyond. Also, if you've ever had a bad experience with one of these tests, or a story to share, drop it in the comments. Your story could help someone else avoid the same mistake or ask a better question. This is Matthew Sharp, and I'll see you in the next one. Until then, take care of those eyes. You've only got two.